Welcome to today's Lunch and Learn webinar. My name is Liz Skilton. I'm an Associate Director of Research at the Kathleen Babineau Blanco Public Policy Center and head of the implementation team for Whole Health Louisiana. We're excited to welcome you to our Lunch and Learn for Whole Health Louisiana today. WHL is a collaborative effort led by the Louisiana Department of Health as the public sector anchor and funder for the Whole Health Louisiana initiative. The Blanco Center leads the plan's implementation and evaluation. If you're unfamiliar with what Whole Health Louisiana is, Whole Health Louisiana is the state's cross-sector initiative intended to systematically address, mitigate, and prevent childhood adversity within our systems of care and support. WHL has 4 priority areas and goals: collaboration, awareness, workforce, and prevention and healing. With these priorities in mind, WHL's vision is to build a state where children and families and community members across Louisiana are healthy and thriving, regardless of who they are or where they live. I'm going to turn things over to Quinn, who will be our moderator for today's session and introduce our speakers. And we'll get started with today's Lunch and Learn. Quinn, please go ahead and take it away.
Thank you, Liz. Hi, everyone. I'm Quinn. I'm a research associate here at the Blanco Center and a coordinator for the Whole Health Louisiana project. I will be moderating this webinar and all of our future webinars along with my colleagues at the Blanco Center. As part of this initiative, we are holding a variety of different activities meant to raise awareness and deepen conversation about trauma-informed care practices. Our virtual Lunch and Learn series touches on the workforce priority area of the Whole Health Louisiana plan and features presentations from industry professionals and subject matter experts. Due to the popularity of the series, we'll be continuing it through the upcoming year, and all of our planned webinars are listed on the Eventbrite page that you all use to register for today's event. Before I introduce our speakers for today, I want to first mention our ASL interpreter for today. You should see her pinned to your screen to view the interpretation throughout. Her name is Lisa Gill, and like I said, she is spotlighted. So if you are having trouble seeing her screen, please do let us know. We did drop some instructions on how to pin her to your Zoom page. In addition, if you are attending for CEU credits, please remember to fill out the CE credit request form and complete the post survey to receive your credits. Okay, now that that is out of the way, I'm going to go ahead and introduce our speaker for today, Kathryn Keating, who is a social scientist with the Community Resilience Center at the Water Institute, where her work centers on the intersection of society, the environment, and science. With more than 8 years of direct experience supporting ecosystem restoration of efforts and working with communities along the Gulf Coast, Dr. Keating integrates academic knowledge with practical expertise to address the complex challenges facing disaster-prone regions. Her work focuses on fostering effective community-led resilience planning and action by addressing gaps in necessary capacity and knowledge. Dr. Keating holds a Bachelor of Arts in Sociology and a Bachelor of Social Work from Indiana University. She earned a Master of Social Work from Portland State University and went on to complete both a Master of Arts and a PhD in Sociology at LSU. She is a licensed master social worker in the state of Louisiana and lives in Baton Rouge. And with that, I'm going to hand it over to her to begin her presentation. Thank you.
Hi, everyone. Thank you for being here today. And I'm very excited to talk to this group and provide some information about my work at the Community Resilience Center. To start off, my name is Kathryn Keating. I am a social scientist here at the Community Resilience Center, and I call Baton Rouge home. And I'm coming to you today from the Water Institute offices on River Road. If you're from BR or you've driven across the bridge, you may recognize the building in this picture here. And that is where my office is located. And today I'm going to tell a bit about how the Community Resilience Center came together and the ways that we're working alongside Gulf communities to build resilience in the face of climate change and environmental hazards. I'll walk through how the center approaches resilience as a concept, what we've learned from communities across the Gulf, and how we're putting those lessons into action. I'll also weave in a bit about how a trauma-informed lens can be applied to this work, recognizing that stress and even trauma from exposure to hazards can create stressors in people and communities, and that needs to be considered when building resilience at the community level. And my hope is that by the end of this talk, you'll leave not just with information, but also with a sense of possibility that resilience is something that we can build together. And before we dive into the center's work specifically, I want to briefly introduce the Water Institute as a whole, because our center is one of several branches within this broader organization. The Water Institute is a nonprofit applied research institute based in Louisiana, and our mission is to advance science and develop practical solutions that help communities live and thrive with water. We work across the Gulf Coast, across the US and internationally, partnering with governments, nonprofits, universities, and local communities. And as I mentioned before, I'm here in the Baton Rouge office, but we also have an office in New Orleans on the UNO campus. And our team spans a wide range of expertise. We've got coastal engineers, hydrologists, specialists and experts in ecosystem restoration, community engagement. And it's this interdisciplinary approach that is what makes our work strong and unique. It allows us to design projects that combine technical excellence with local knowledge and that are both scientifically sound and socially relevant. The Community Resilience Center itself fits into this larger picture as the branch focused on advancing community action toward resilience. It serves as a hub within the Institute where communities can find resources, opportunities, and connections, including partnering with the interdisciplinary experts here on the Water Institute's team. This slide highlights some of those interdisciplinary team members that make the Institute unique. Our team brings together those coastal scientists, civil engineers, social scientists like me, planners, economists, and policy analysts. We also have people on board with backgrounds in social work, public health, and community engagement, which is also where I fit in. And this range of expertise is powerful because complex challenges like flooding, ecosystem loss, and disaster, they don't sit neatly in one discipline. And this approach allows us to integrate physical, ecological, and social systems into our work, making projects more equitable, effective, and sustainable. This environment of collaboration and partnership gave rise to the Community Resilience Center, which brings a community-led focus to the work that's happening here at the Water Institute. And before moving on, I wanted to pause a little bit to give you some background about how I came to this work, because it really shapes the way that I approach it and show up. I am an environmental sociologist and also a social worker. So I worked in rural primary care settings and also hospital settings before I came to LSU to pursue my PhD in environmental sociology. I've always been interested in how environmental stressors and social systems intersect to affect people's well-being. And early in my career, my research focused on the experiences of Louisiana families in the years following the Deepwater Horizon oil spill. And my background has really highlighted how important it can be to bring a trauma-informed lens to this work. You need to recognize how things like economic instability, health challenges, and repeated disaster exposure can compound and create stress. And making sure that people can find the resources, support one another, and participate in resilience planning and action that reflects their experiences, priorities, and lives is key to this work. Before stepping into my current role at the Community Resilience Center, I served for 5 years as a social science analyst with the Gulf Coast Ecosystem Restoration Council. It's a federal organization that is focused on ecosystem restoration across the Gulf following the Deepwater Horizon oil spill. And last year, I started my current role as a social scientist at the Community Resilience Center. And I was so excited to get started weaving my mixed methods research expertise and my community work together to work side by side with local partners on all of the different projects that incorporate evidence for an evidence-based approach to action and planning, and also elevate community leadership. The center is relatively new. It was established in 2023 by Dr. Renee Keating. Dr. Keating is a widely respected leader in resilience across the Gulf and has served as an author on the 5th National Climate Assessment. I dropped a QR code here that links to her bio if you'd like to read more about Renee's background. And the center's work is Gulf-wide. It was intended to support all 5 Gulf states and be very community driven. A lot of the work that I focus in on is in Louisiana because I'm based here in Baton Rouge, but we have other projects going on across the Gulf, and I'll highlight a few of those as I move forward with the presentation. We see our role as partners, working side by side with local leaders rather than coming in with a top-down approach. And the process of establishing the center followed that same philosophy. It was built through listening and collaboration from the beginning. So I'm going to talk a little bit about the overarching timeline of the CRC. This slide is going to show the trajectory of the work up until today. And I like to walk through it because it reflects how intentionally Renee and the center team approached this process. I wasn't on board yet, but I joined in 2024 and have been so excited to jump in. So in 2023, though, the focus was really on listening and learning. The team spent time reviewing existing literature, assessments, attending community meetings and listening sessions, and hosted a center kickoff workshop. And that year was really about showing up, building trust, and understanding the landscape, what people were already working on and what people identified as areas to build and fill gaps, rather than just jumping straight into action. So moving into 2024, the center began charting the path. A 3-year strategic plan was released, and I'll talk a little bit more about that in a moment. And we started conducting preliminary research and launching some pilot projects with our partner communities. And now, as we continue forward into 2025, we're walking the path, continuing and expanding those pilot projects, scaling up our research, pulling together evaluation information to understand the impact of those projects. And it's really a shift from planning into action, and it's been so incredible to be a part of it. And one thing that I want to highlight is that this timeline isn't just about meeting organizational milestones. It's about relationships and building trust. It's intentionally slow and builds in consistency because people need you to show up over time before they feel comfortable investing their own time and energy, which is completely valid. So this slide provides just a little bit of a deeper dive into that first year of listening and learning. In 2023, before launching any of the projects, we did all of that background review, talked to community partners and stakeholders, and held a kickoff workshop. This graphic here is a great graphic facilitation that came out of the kickoff workshop, and it really just highlights the variety of topics that came up and rose to the surface through the collaborative efforts over the course of the year in 2023. So you can see we have analysis of existing documents, seeing where there might be gaps, what's missing, ways that people are using existing reports, and understanding systems that underpin the resilience work that was already happening in the Gulf. I'm going to hop over to another slide that shows even more. So this slide here illustrates in a little bit more detail some of the discussions that happened in year 1. We heard topics like community support, tipping points, listening and turning to HBCUs and other minority serving institutions, and identifying connections across places and data between community leaders, addressing questions about insurance availability and affordability. And all of this input from the workshop, from all of the community meetings, conversations, the background review of existing reports and literature, all of it culminated into a 3-year strategic plan that the center put out in 2024. And the center has used the plan to guide all work going forward from there and to shape resilient strategies that are intended to be developed out of the realities that people are living in the Gulf. So this slide shows the mission and vision statement for the Community Resilience Center. So this is something that came out of that year one collaborative work, really honing in on a mission and vision for the center to increase climate resilience in the Gulf Coast by addressing barriers and making more capacity and expertise available to support a broader array of Gulf communities. And a vision of a Gulf Coast where every community has the power, knowledge, and resources to adapt and thrive in the face of climate change. These statements came directly from the synthesis of all of the year one listening and guide the work that we do today. And just for fun, I just do want to point out that Dr. Collini's dog Franklin is featured prominently in the photo here of a community-led event in Biloxi. So this slide is simple, but it really illustrates some of the key connections to climate and environment that underpin our work. And just to start off, first, our climate is changing. We're seeing warmer temperatures, shifting seasons, and more intense weather patterns. And these changes drive shifts in hazards. So stronger storms, more flooding, longer heat waves, more drought, even some of the unusual snow that we saw earlier this year in Louisiana. And when hazards change, people are impacted. And this is especially true for people who are already facing social and economic stressors. This simple chain, climate leads to changing hazards which impact people, is the foundation to a lot of the resilience work that centers people, not just physical risks from climate and environment, into planning and action. So let's dive a little bit deeper into those changes and hazards. We're going to zoom in on how on the changes that we've seen in Louisiana at the state level and kind of what it means for people's daily lives. So statewide, we're seeing more frequent flooding, not just from big hurricanes, but also from slower, heavier rainfall, and that can overwhelm drainage systems. We're also seeing a loss of nighttime cooling, which means people and their homes don't get a break from heat waves, higher energy bills. We're seeing shifts in seasons, earlier springs, hotter fall, and more extreme rainfall, drought, and heat waves. And these kind of patterns sound abstract, but they affect all sorts of things in our day-to-day lives. So kids walking to school, elders without air conditioning, people who work outdoors, farmers, and entire supply chains. And this is where we really start to think about climate impacts intersecting with health. For example, higher heat and humidity are linked to heat stress and dehydration. And those risks are greater for people who already have limited access to healthcare or are living in substandard housing. So even though these changes are environmental, the impacts fall on people, especially people who may already be more exposed or more sensitive due to social or economic conditions. And that's why resilience work must be both climate informed and equity centered. So let's zoom in a little bit further and look at what is happening in coastal areas where many of our partner communities are located. We're seeing increased erosion, which is literally reshaping coastlines. We're also seeing more frequent and intense storm surge. That pushes water further inland and increases the depth of flooding during hurricanes. But even outside of a storm scenario, high tide flooding is also becoming more common in the Gulf. And that can damage infrastructure, contaminate drinking water. And we've also seen saltwater intrusion, pushing salt into wetland soil, drinking water. That damages ecosystems, but also the livelihoods of people who rely on them. So for communities that may already be recovering from past disasters or experiences with other hazards, each of these types of hazards adds another potential layer of stress, economic cost, or uncertainty. So again, just keeping in mind that when we talk about these kinds of hazards, we just have to keep in mind that they can take kind of like a compounding toll on mental and physical health. And that's why our work includes not only physical risk reduction to the natural and built environment, but also supporting social and mental resilience of communities. So just touching again, getting a little bit deeper into impacts on to people. This slide just kind of talks through how all of the changing hazards that we just talked about translate into real human impacts. And this is where the conversation circles back to people's lived experiences. So first, we see rising costs for individuals, businesses, and whole communities. This can look like a lot of things: damages to homes, higher insurance premiums, and the cost of replacing essential goods, especially repeatedly. We also see school and business closures, disrupting income, education. You might have to stay home from work if your child's school is closed. Access to critical services, all of these things become disrupted. Storms also affect fishing and agriculture through some of the pathways that I just discussed. That can be connected to food insecurity. We can see supply chain interruptions and also damage to housing. Economic impacts at the community level can impact availability of resilient, affordable housing in our communities. We also know that there are human health impacts. So physical, like heat stress, decreased air quality from things like wildfire smoke, dust, shifts in disease vectors following flooding or storms. And there are also some mental health impacts to consider. We know that there are higher rates of anxiety, depression, and post-traumatic stress following the experience of a major storm or flood. And this is where, again, keeping in mind that trauma-informed perspective and focus on equity can become very important. So this quote is one that we use in a lot of the presentations and discussions about the work of the center. And I think it captures so much of what we've seen and what goes into structuring the different approaches to resilience that we engage in. So we're not all in the same boat. We're all in the same storm. Some people are on super yachts and some have just one oar. It's just a reminder that in the Gulf, everyone is experiencing these hazards and impacts, but not everybody has the same resources or safety nets to recover in the same way. It just brings back the idea that resilience isn't just about withstanding storms, it's about ensuring everybody has the tools they need to prepare for and the support to recover from and adapt to these types of hazards. That kind of leads into some of the guiding frameworks that we use to talk about resilience itself. So the term resilience, it's been used in many ways and has different meanings to different people. It can be interpreted at the individual level in terms of the way a person bounces back and adapts all the way up to the broader community. And here at the center, we are really looking at the community and structural facets of resilience. And so we use a simple, powerful definition of resilience as reducing vulnerability. And we consider three parts of vulnerability. We look at exposure, where people, assets, and ecosystems are located relative to hazards. So this is a very common way of understanding vulnerability. So we're thinking about coastal areas that experience more frequent storms than other parts of the country, for instance. Sensitivity is how strongly a person or a community might be affected when they are exposed, and a lot of things can impact sensitivity. And then adaptive capacity is the ability to withstand, adjust, or recover from a hazard. So just thinking through like a real life example, just imagine a neighborhood that floods regularly. If homes are built at ground level, they're more exposed. And if many of the residents are elderly or have chronic health conditions, they may be more sensitive to harm from flooding, like increased exposure to mold, for instance, or the stress associated with recovering from flood. There may be limited staff capacity in the community to support those higher needs. If that's the case, then we would want to consider the resources and the availability of capacity to support people as they recover from a flood event in the community. And each of these factors, exposure, sensitivity, adaptive capacity, they're different for different communities in the face of different hazards, but they can be changed. And that's where our work comes in. By reducing exposure, sensitivity, by reducing exposure, reducing sensitivity, and increasing adaptive capacity, we can reduce vulnerability overall. Some projects address all three of these areas. Some may just target it on one, like adaptive capacity. But this model really helps communities see where they have leverage points and gives a shared language to design resilient strategies together. So I'm going to move on to our next slide here. In addition to that framing of resilience as reducing vulnerability, there's another core framework that plays into the work we do, which many on this call are probably familiar with. It is the social determinants of health framework, the conditions that people live, work, learn, and play in, and how they shape so much about our day-to-day life, our health, and how we experience and recover from exposure to hazards. So the inclusion of a social determinants of health framework into resilience work allows us to ask, from these social conditions, what could be strengthened to reduce exposure, increase adaptive capacity, or reduce sensitivity? And I'm going to click over to our next slide and just talk through a little bit of a crosswalk that we have here. I already gave some examples when I was showing our slide on reducing vulnerability, but here you can kind of see the intersection of vulnerability and those social determinants of health. And we've kind of crosswalked them with a few different examples. So for exposure, we might look at neighborhood and built environment. If homes are elevated or built with flood resistant materials, they may be less exposed to flooding. And then sensitivity, we can consider healthcare access and quality. Robust access to preventative care may result in people who are healthier overall and less sensitive to physical impacts from hazards like heat or mold following a flood. And then under adaptive capacity, we can consider education access, quality, providing people with the information and tools that they need to understand, support, and participate in resilience work and adaptation strategies. Allows them to make more informed choices and to advocate for their community from their local expertise. And this slide just lists some of the many entry points for resilience projects. I like to show it kind of early on because it can give you a really good idea of all of the different types of projects that we consider resilience work. Working toward resilience is not a single program or fix because of how multifaceted vulnerability and health especially can be. And so just looking down the list here, this work can be anything from capacity building for community members to pursue and manage funding for work going forward, mental health programming, increasing food security, including things like community gardens, hazardous waste disposal and education to reduce exposure there, addressing heat hazards, increasing communications so that people are better able to get connected immediately after experiencing a hazard event, storm, a flood, and also to share information ahead of time. And then Of course, disaster preparation and response. And then last, something that we talk about a lot is kind of aligning economic resilience with all of these other factors. So, if something key to the supply chain is disrupted, how can businesses and communities recover more quickly? Is there any advanced planning that can happen to ensure that businesses can reopen as soon as possible and people can get back to their livelihoods? So as you can see, there's many ways to work toward resilience in the Gulf. And part of that initial year of listening and learning was really honing in on areas where the center could make a difference, areas where people weren't already doing a lot of incredible work and we would potentially be duplicating that, and areas of opportunity where the center's technical expertise and the expertise here at the Water Institute could plug in. So all of that conversation led to 4 focus areas that we work in: insurance affordability and availability, community-led migration, legal frameworks and approaches, equitable flood risk and planning, equitable flood risk planning and policies, and then fundamentals for equitable climate resilience, which is my focus area, and I'm going to dig in a lot more in just a minute. I put a QR code here in case you want to scan it and read in detail about each of these focus areas. And I'm happy to answer questions about them afterwards or set up a call to talk more about them if you're particularly interested in insurance, community-led migration, or flood risk. And I did want to just note that when we're talking about insurance affordability and availability, what we're talking about is home and flood insurance, ensuring that people can recover and afford the insurance that they need to be supported in doing so. Okay, so I'm going to jump into fundamentals because that is the area I lead. And what we are talking about here is the foundational building blocks that communities need to fully engage in community-led resilience planning and action. So it can look like a lot of things, and it looks different for every community. But broadly speaking, we're talking about addressing foundational gaps in capacity, knowledge, and support, and understanding and tackling inequities and barriers to community-led resilience. So there are a few approaches that we use to do this, and I'll show some examples of projects that blend a couple of the different approaches into the work that's going on. So the first is inclusive and culturally responsive decision-making, making sure that local voices are at the table from the start. And we help communities design engagement processes that are community-tailored and meaningful. The second is capacity building for resilience actions. So this can look like a lot of things as well, but broadly speaking, we're thinking things like training staff of local governments, municipal leaders, community-based organizations, helping write grants, creating work plans, and coaching leaders so that they can carry projects forward and move them into the next phase. Building networks for resilience, strengthening connections that are already there and making new ones. And then sometimes resilience support is needed to plug in and get a project to the next phase. And so one of the really cool things about being a part of the Water Institute is the connection to all of the interdisciplinary expertise that we have from a coastal science perspective. And when it makes sense, plugging that expertise in to bring a project to the next phase or move the work forward. So together, all of these approaches, they're lowering the burden on local leaders and creating momentum that can be sustained. So I'm going to jump in with a couple of project examples because I feel like what I've been talking about has been a little abstract, and it's really fun to highlight some of the incredible work that's been going on. So I'm going to start with one of our earliest fundamentals focused efforts, Resilient East Biloxi. This is a capacity building and economic development project that's also addressing key issues related to flooding in East Biloxi. And the activities involved are There's a couple of different things that are happening with the community. It's been going on since 2022, and each year there's a cohort of community leaders that comes together to plan and implement training sessions, community actions events, which is what's in the bottom right-hand corner there. There's a group doing a trash cleanup in the community that's led by the cohort of community leaders and the project team. And then also implementing a community festival, which the other photo here just shows some of the dancing happening at the community festival last year. It's been a really great example of how local leadership networks and capacity, they can support like meaningful resilience planning that is targeted to the community, guided by people who are on the ground working in the community-based organizations and planning everything from the ground up. The center also offers a series of training called the Meaningful and Effective Engagement Training. It is adaptable. It's something that we can adjust for the audience. And it's really geared towards providing municipal leaders to engage with a diverse range of stakeholders. So it's a capacity building effort, and to date, we've held a number of trainings across the Gulf, including in Louisiana, Mississippi, and every time it looks a little bit different, but we're broadly providing information to allow participants to identify and consider different types of stakeholders in their specific community, recognize where there might be community stressors or gaps that impact the way that people engage, and to design and facilitate engagement. So the MEET training itself is really just intended to give local leaders the tool to take engagement from like a box checking exercise and move it into something that is meaningful and trust building. And I'm going to quickly touch on this project in Texas, led by Dr. Katja Woke, a senior social scientist. This project is a mixed methods approach to integrating a lot of different ways of knowing national level data, local knowledge through a action committee of healthcare practitioners and local experts that are working on the ground in Nueces County in Texas, bringing all of this information to describe and contextualize challenges related to health and social determinants of health, and also climate and environment for the people living in Nueces County. And finally, this is a very exciting project that's built a lot of momentum this year in South Terrebonne and South Lafourche parishes. It is led by our incredible community partner, Bayou Community Foundation, and Anchor the Bayou. Anchor stands for Assessing Needs and Capacity in Historically Overlooked Regions of the Bayou. This is a capacity building resilience program. It's modeled off the Resilient East Biloxi model with a cohort of community leaders who are coming together to build capacity, identify trainings that would be helpful for them to engage in, to build capacity to continue work on resilience going forward. And it involves a couple of different phases. You'll see here on the slide, a needs assessment, which we're currently working with BCF on now. It's involved listening sessions, a survey. We're planning some focus groups, the development of a strategic plan. And this is something that's really going to be informed by the needs assessment, the voices of the community members. And then from that strategic plan, implementation of the capacity building exercises and some community events similar to what we saw and talked about with Resilient East Biloxi, but tailored specifically for South Terrebonne and South Lafourche. And then finally, like the last phase of this project involves identifying like a key pilot project that the cohort of community leaders are especially interested in implementing, and coordinating the work to get that pilot project started, figuring out an evaluation plan that will allow the community to evaluate the success and the impact of the project. And so this is, again, a really exciting project that is going to have a lot of momentum continue through the end of 2025 and through 2026. And I dropped a QR code here. If you, it will take you to the Bayou Community Foundation's website where you can read a little bit more about Anchor and stay up to date on the work that's going on there. So Anchor is what we call a community resilience catalyst project right now. The Bayou Community Foundation is a participant in the center's catalyst program. And before wrapping up my presentation and opening up the floor for questions, really just want to kind of provide a bit of background about this program and where we are with it. We launched in the beginning of this year, and the catalyst has two components. And it's intended to support Louisiana coastal communities. The first component is education. So our Catalyst team at the center works with communities to provide trainings with information, kind of like some of the things that I've talked about today. Background on talking about and framing resilience, brainstorming on resilience projects, and looking at existing work that communities are already doing. And thinking through next steps and how to address potential barriers. And the second part is our Catalyst technical support. So the intent of the technical support is to provide technical assistance, primarily from the Water Institute and the wide array of interdisciplinary technical expertise we have on staff, but also our partner networks, to plug into a project that a community organization may already be working on and catalyze the work to the next phase. So communities in coastal Louisiana parishes can submit a brief request on our website, and the QR code and website here will take you to the center's Catalyst page. And what we ask on the front end is kind of a description of what you're already working on and how you think technical support might help move it into the next phase, whether it's accessing some of our planning expertise to develop a plan that may be used to pursue funding, or data collection needs assessment to inform the next step of a project. There's a wide variety of projects that would be eligible for Catalyst. And thinking back to some of the concepts that I talked about earlier, if a project is addressing one of those facets of vulnerability, so if it's addressing exposure, adaptive capacity, or sensitivity, and it is also has the potential to make a meaningful impact on some of the social determinants of health, then that project would be considered eligible as part of the holistic definition of resilience that we use for Catalyst. And so just to give you a picture of what that looks like to date, we have two communities in the Catalyst program. The first is Bayou Community Foundation with Anchor the Bayou that I just talked a little bit about. And so Bayou Community Foundation is working with Catalyst funding to implement focus groups that I mentioned, develop that strategic plan, and implement all of the leadership cohort trainings that will happen over the coming years. So we're really excited to continue to partner with BCF on that. And then we also have Habitat Recovery Project that they are located in Cameron and Calcasieu Parish, and they work very closely with groups of shrimpers and fishers. And for their project, our expert ecologists here at the Water Institute are partnering, coming together as a team to co-develop a science-based monitoring plan to inform the Habitat Recovery Project and their partners' decision-making and action strategies. So both of these projects, the Water Institute is plugging in specific type of expertise. For Anchor the Bayou, it's some of the planning, evaluation, and research expertise. And then for the Habitat Recovery Project, we're really bringing in the ecology perspective and monitoring expertise in-house to bring the work that was already happening in both of these communities into the next phase and catalyze it. So at the same time, we are accepting requests on a rolling basis, and so we continue to receive the requests. And if you think that you have a project or you know someone who's working on a project that might fall into The definition of resilience, as I've talked about a little bit today, I would be incredibly excited to set up a meeting and talk to you a little bit more about it. I'm one of the outreach leads and would be happy to kind of do some brainstorming and scoping with you to see if it might be a good fit. And then I also just want to circle back to the education component. If you think that this information might be of interest to your organization or another group that you're involved with in your community, our Catalyst team is available to come and deliver a version of a presentation on climate resilience, similar to some of the concepts I've discussed today, but tailored to your community's interests and what folks are hoping to learn and talk about. So that takes me to the end of the presentation. Looks like I'm right about on time. And I just want to thank everybody for being here virtually with me and to the Whole Health Louisiana team for bringing us together. I know I covered a lot of ground from climate-driven hazards and their impacts to the frameworks that we use to understand and address resilience. And then I'm happy to share some of the exciting updates on our projects that are on the ground being implemented with our community partners. So just want to reiterate that I would love to connect with you if you want to meet up. And I'm based here in Baton Rouge. I'm usually in the office here on River Road on Tuesdays and Thursdays. And so please feel free to reach out by email. The QR code here will take you to a virtual business card that has my contact information as well. So I would love to connect. And you can also follow the center's work on the Water Institute's website. So the QR code is there as well. So with that, I think we have a few minutes for Q&A. So I'd love to hear your thoughts, questions, or reflections about any of the concepts that I covered or your own work that might intersect.
Thank you so much, Dr. Keating, for the presentation. I loved it, and I love your slides too. They're just really colorful and makes it really engaging. So again, thank you so much for being here with us today. So we have one question already, and Edward asked, what policy barriers most commonly slow down resilience efforts in Gulf communities?
I think that is very dependent on the type of work that's happening and at what phase. So I think that on the front end, when thinking through a timeline and a plan for the work, working together with all of the project partners to try and scope out a timeline that considers any potential approaches to environmental compliance and other sort of compliance documentation realistically is important on the front end because it can be very easy to get excited and scope out a timeline that gets you to action immediately, but that planning phase can sometimes take a little bit longer just depending on what comes forward with the initial plans. So I would say that being prepared to adaptively manage policy conversations and bring together the important documentation to move into implementation phase for projects that address both is really key. And then just broadly speaking, I think that it's highly dependent on the type of resilience work and the community that the work is happening in terms of policies that may impact whether or not a project meets its measures of success and impact for the community itself. I hope that was specific enough. I'm trying to think of a specific example, but maybe if the person who asked that question wants to follow up offline, we can meet and talk through it a bit more.
Thank you for the response. Does anyone else have any other questions they would like to ask Dr. Keating? Please go ahead and drop it in the chat box for us. While we are waiting for more questions to come in, I'll do a quick reminder for everyone about the CEU forms. So just please remember to complete your CEU forms and the post survey so you can receive your credits. We have another question, Dr. Keating, that asks, what are the most useful data sources or metrics you rely on when advising on resilience actions? And what metrics are used to evaluate success in the short and long term?
Thank you so much for that question. That's something that I think about a lot in my role. So to speak to the first part about data sources, one of the things that we try to incorporate into most of the conversations that we have with community partners, kind of beginning partnership and work around resilience action is tools, publicly available tools that incorporate data for to inform planning and implementation of projects. So one thing that I can think of off the top of my head that has proven really valuable for rural communities is an online tool called that maps rural capacity, and it is an effort from Headwaters Economics, and I think had some federal funding on the front end from USDA, and it really gives you some composite measures of capacity in rural areas, so like access to a car across the community and things like that, and maps it so that you can speak to your own community when discussing rural challenges, which can be important to highlight when pulling together grant applications and descriptions for projects. So that's one. The CDC also has a really great heat health and vulnerability tracker, which is another mapping tool that allows you to look at the intersection between heat exposure and health vulnerability, looking at population characteristics that that intersect with vulnerability to heat. And then as far as metrics used to evaluate success, this is something that has been really key for the Catalyst program. So at the overarching program level, we are looking at a number of different measures of success for the program itself, from outreach, collecting evaluation feedback from some of those educational meetings we have, and then also collecting programmatic level metrics from each of our Catalyst projects to understand and be able to roll up some of the measures that we're collecting and describe them at the program level. But for each of the individual projects themselves, so Anchor the Bayou and our project with Habitat Recovery Project and any new projects that come in, we actually co-develop a project evaluation plan that identifies quantitative and qualitative measures of success and any existing publicly available data sets that may be valuable to tracking impact and project success, both national level data sets, but also data that may be available at the community level.
And someone posted another question that's related to that data question. How are communities including these metrics into their resilience plans and projects? Do you have any examples of communities that are doing a great job of including them?
I think that coming back to the project level evaluation for our Catalyst projects, for instance, we are looking at identifying some of the kind of easiest to track measures of success, such as like, did we successfully complete the implementation of a workshop, for instance, or leadership trainings? But then we're also looking at evaluation tools from participants to gauge whether or not people felt like it was a good use of their time, if they would be comfortable talking about the topic of a given training or workshop to someone in their community. We've got a series of evaluation tools that we administer after any event like that. And then As far as the co-development of project-specific metrics, it's really based on the work that's going on project to project, but we are bringing in myself and some of the other social scientists and policy experts, and then for Habitat Recovery Project, our ecologists, to identify other types of data and metrics that we can identify and bring in and support the community in tracking to understand the impact over the course of the project itself, but also at periods a year after and 3 years after the project has been implemented to understand the impact over time. And that aspect of the evaluation for the Catalyst project is really something that's co-developed with the community partner. However, the tracking and some of the data collection and management components, in a lot of cases, we anticipate that the Water Institute will handle that because we have a lot of capacity for data analysis, collection, and expertise.
I think we have time for maybe one or two more questions, but I have a question of my own. I was wondering, how can organizations that work directly with communities help build resiliency towards climate change impacts? So flooding, hurricanes, things like that. We know with climate change that, those events are happening more frequently. And with current administrative changes, there's lots of defunding in organizations such as FEMA that can help communities. So for community-based organizations, how can they help their communities with these issues?
Yeah, I think that connecting back to the first question we had on policy impacts, what you just mentioned about shifting administrative priorities and funding cuts, has definitely been something that, like, broadly speaking, people involved in climate resilience work have been addressing as a challenge since the beginning of the year. And so I think that one thing that pops to mind for me is that expanding an understanding of resilience beyond just actions and activities immediately after, for instance, a declared disaster storm, right? And thinking through, like, proactive work, addressing other types of hazards, things like flooding from other types of storms, heat, some of the issues that may have arisen in communities with the extreme cold and snow this year, all expanding your how you're conceptualizing hazard exposure is one piece, and then also thinking through a more holistic view of resilience and resilience work as work that incorporates consideration to the social determinants of health and all these different social and economic factors that impact people's day-to-day lives, and just by the nature of those factors intersect with some of these climate and environmental hazards. And I think to that point, much of the resilience work that we engage in and that people are engaging in across the Gulf has a direct connection to health or mental health. And it's a matter of exploring partnerships with people that are already on the ground working in places and seeing and hearing what they're hearing from the folks they work with and serve, and incorporating that expertise into planning and pursuing funding that may address more holistic approaches and incorporate a variety of different disciplines.
Thank you, Dr. Keating, for your time. And thank you to our interpreter, Lisa Gill, as well. We are at time. So again, thank you guys for coming, and thank you for presenting again, Dr. Keating. This has been very informative. So that's the end for our webinar today. And again, just remember to take the post survey if you are getting CEUs. But other than that, thank you everybody for attending. And we will see you next month.